Do you know what causes the blocked tubes?
Inflammation, infection. And we find that biopsy is showing some sort of sperm activity inside the testis. Then we think in the terms of blocked tubes. Mostly UTIs, urinary tract infection, which travel into the vas and cause the blockage. And we find that biopsy is showing some sort of sperm activity inside the testis. Then we think in the terms of blocked tubes. Bilateral inguinal herniatomy in his childhood is likely to suffer from complete blockage in both the tubes.
I want to welcome you for our series on blocked tubes for male reproductive system. I'll introduce myself. My name is N. Jamir, and I work as a content creator and an interviewer for a company called Subhak Health Tech. We have got two products in the market, Androwash and the We Conceive home insemination kit. So as a way to democratize the stigma around infertility, we are having these talks with multiple specialists such as yourself. Thank you for agreeing to do this with me. Would you kindly introduce yourself, Dr. Pradeep?
I am Dr. Pradeep Kumar Sahu. I am MS and MCH in pediatric surgery from PGI Chandigarh. My wife is gynecologist. She does all those things, infertility, etc. And I, as being surgeon, done some recanalization procedures for the people who had undergone vasectomy earlier.
Okay.
So I have good experience of blocked tube and recanalization also.
So you are the perfect person to talk about blocked tubes.
Yeah.
So,
yeah, sure.
Please tell me, how long have you been practicing?
Almost 15 years now.
Okay. May I ask you one question? Please tell us the different types of blocked tubes in the male reproductive system. What exactly is a male reproductive system blocked tube?
Okay. Actually, I come across many male patients who have got 0 sperm counts. So we do testicular biopsies for all of them.
Okay.
No production at all. Then we declare them as what do you call that? Agiospermics. And we find that biopsy is showing some sort of sperm activity inside the testis. Then we think in the terms of blocked tubes. And then we try to find out the causes.
Right.
In last case that I told, there is vasectomy who lost his child. So he had to undergo recanalization for vasectomy. So that was a successful case.
So that means the blocked tube is unblocked in this case.
Yeah. The tube was surgically blocked in vasectomy, and I recanalized it. And he had another after that.
Okay. Is this kind of procedure very painful or?
No, not at all. Not at all painful. We do it in spinal anesthesia, so it is painful.
Okay. Do you know what causes the blocked tubes?
Inflammation, infection.
Are these infections sexually transmitted infections or just other types of infections? Okay.
Sexually transmitted diseases as well as other diseases which are not even transmitted.
I see.
UTIs, mostly UTIs, urinary tract infection, which travel into the vas and cause the blockage.
But these are surgically modified, right? Corrected.
Yeah.
Right.
I mean, sometimes it is possible to surgically modify, but most of the time, since the tube is very long and the blockage can also be very long, so I don't think it is possible to recanalize the whole length of spermatic cord.
You mentioned inflammations leading to blocked tubes. What kind of inflammation are we talking about here?
So people having generalized infections, which is traveling into the body, and causing exudations in the tubes.
And the inflammations?
Yeah.
Okay. I saw that injury from surgery also causes tubal blockages.
Yes. You have pointed it very rightly. The children who have bilateral archaeopaxies, bilateral undescended testis, they undergo surgery for bringing the testis down. These are the children who suffer the most. And also in cases of hernia, bilateral inguinal hernia, if someone has undergone the procedure bilateral inguinal herniatomy in his childhood, he is likely to suffer from complete blockage in both the tubes.
And is this like inadvertent or is this intentional, the blocked tube?
Intentional. Most of the time, when the child is neglected for a very long period and the hernia has grown into the huge sizes, dissection becomes very difficult. It becomes inadvertently, somehow they got injured.
Okay.
They get injured.
And when this kind of injury happens, is it reversible or is it usually unreversible, sir?
If you can find out, there are newer ways to find out where is the block, then maybe it can be reversed.
Okay.
Otherwise, it's simply not reversible.
Could it all, and so undescended testis is something which is caused by abnormal development of the male genitalia, right?
Yeah.
Right.
So that is kind of congenital abnormality.
Okay. What is it then?
Congenital, it is since the beginning they do not have descended testis. Testis is lying somewhere in the inguinal canal or in the abdomen. So they inherently lose the property of making sperms. Ideally, testis should be at 5 degrees lesser than the body temperature. And since the testis is lying whole time inside the abdomen, so the formation is not occur.
And so it kills the sperm also.
There is no production at all. It doesn't kill actually. There is production itself is hard.
Zero production of sperm.
Yeah.
Dr. Sahu, it also says that cystic fibrosis is also a cause of blocked tubes.
Cystic fibrosis is definitely one of the causes because there is no ciliary movement in the lumen of the vas. So there is no propulsion of the sperm. So no ejaculation of the sperm. So it results in infertility.
Right. So can this happen in just the testis or does it happen in other places, the blocked tubes?
Cystic fibrosis, if it is affecting, this is a generalized disease and the obstruction in the lumen of almost every tube of the body.
Okay.
And cystic fibrosis most commonly affects the lungs, where the small tubules, the small alveoli, they are also affected and person is not able to breathe properly. So it causes problem in almost all the small size tubes in the body, including vas.
Okay, so it's not just the vas deferens tube which is blocked, but all the other blocks as well. What is the treatment procedure for something like this case?
Cystic fibrosis remains, to my knowledge, mostly it is untreatable. Some medicines are used, but effect is not overall good.
Okay. So when somebody comes to you with a blocked tube, and those could be caused by, let's say, like you said, vasectomy or other injury causes, abnormal development and everything, what are the course of treatment?
If he has undergone vasectomy, then we straightforward go for doing vasectomy. We go for recanalization of the vas. In the rest of the diseases, we don't really we are not really in a position to do anything. To my knowledge, there are certain things, maybe I have read these things years back, so I'm not aware of the recent developments. But to my knowledge, which can detect the blockage in the tubes, so mostly it remains untreatable.
Okay.
And if you want to have there is bypass. Bypassing tube is the only way. You can directly go into the testis and you can pick the sperms from there.
You talked about vasectomy. When the process is done and you are recanalizing the tubes, is it usually successful or is it not successful all the time?
Most of the time it is successful.
But there are chances when it's permanently blocked.
Yeah, it is more than, apart from the place of vasectomy, if it is he is having any inflammation, infection, any other sort of disease which can obstruct rest of the vas, then reversal or recanalization will not be fruitful.
Okay. When you do a surgical intervention, what are the post-surgical or post-procedure care that needs to be given?
Usually, only problem I think is hemorrhage. The patient who undergo all these procedures, even for vasectomy, they develop large amount of hematomas and infection. They were causing necrosis of the scrotal skin. So that is only thing I remember. I mean, there may be many theoretical possibilities of complications, but what I have seen is hematoma and infection. That's all.
Okay. So when infection or hematoma happens, what is the course of treatment? How do you care for them? How do we care for
Mostly
them?
we try to first line of treatment is conservative only. We give antibiotics, we give cold compresses, expect that it will reduce over the period of time. But if the hematoma is enlarging and it is causing too much a problem, then incision and drainage is the only solution.
I see. How does someone know whether their tubes are blocked or not? What are the symptoms?
Simple test, sperm analysis, sperm count itself will tell. If there is no sperm, then we will suspect that he may be having tubes.
Okay, but is there no other symptom apart from doing a semen analysis?
People are perfectly all right, they are perfectly healthy, everything, but they don't have sperms in their semen.
Right, so for blocked tubes in the male reproductive organs, there is no other symptom, like for example, painful intercourse or inability to ejaculate on properly. No symptoms at all?
No, I mean, ejaculation is mostly the semen, is mostly the prostatic secretions. The prostate is the medium for sperms to travel. So the prostatic secretions come out, but have any sperms in it.
And so there's no pain even during intercourse, just no symptom at all.
If he is not having any active infection, then he will not have any.
So this is such a case when a male doesn't know that he has got a blocked tube, and he just goes
most of them, 99% male do not are having any problem with their sperm counts.
And so they just go about life, and one day when they try to start a family is when they know there's something wrong.
Yeah, then only they come to know.
That's true.
Mostly in India, people blame their wives for that, and when they come to our hospitals and we get them investigated, then only we come to know that the fault is lying in the male.
So it's a silent disease.
Yeah, silent. And most of the people, even the fact that they are not having sperms, they simply hide the fact. They simply keep on blaming their wives.
So that's very interesting, because why do you think that happens, Dr. Pradeep?
Because there is stigma. I mean, the masculinity of a man is questioned and challenged. So they try to refrain from answering those questions. They always try to prove that they are doing best and the fault is lying somewhere else.
That's very unfortunate, though.
You can say male ego. Male ego, our societal norms, they do not permit a man to be called something other than what he should be called, actually.
And you've had experiences like that when it's the male partner who is at fault, but the female gets partnered?
Yeah, many. I know many couples where the fault is lying in the male, and they just don't agree. They don't even agree for IVF. They don't agree for anything else. They even warn their wife, if they are getting pregnant by any means, then they will abandon her.
My God.
So this is also happening. Yeah, this is true.
Does that happen?
They don't even want to adopt. They don't even want to adopt a child from orphanage. They just don't want anything to be done. They just want to escape.
But if they don't get treatment, then the problem is going to be carried by them only. So whether they change partners or not, that problem is going to remain.
Earlier, when multiple marriages were allowed in the Hindu society, they used to get many females, and every time they did not conceive when they died. So that is what was happening earlier, 30, 50 years back.
Here's a question. Do you see a change in the way your patients are coming to you? Do you see enlightenment? Do you see understanding from the male partner also?
Yeah. many educated people who do not have so much of male ego, they try to do something. I mean, whatever is possible you can do, they are ready to go ahead with treatment.
Okay. Coming back to blocked tubes in the male reproductive organ. Now, you said that there's no way a male can know that their tubes are blocked.
Yeah.
So this question might be redundant, but in case somebody knows through different tests, how can they naturally unblock tubes? Is there a way?
I don't think there is any way of naturally unblocking the tube. I mean, maybe recent advances may cause some sort of reversal. I don't know about that.
Okay. All right. What is, an advice that you want to give males in particular when it comes to the reproductive organ and system?
First of all, I give them a lot of YouTube videos to see, then they will come to understand what actually is happening with them. Because most of the people don't even know how a baby is born. This is also a fact, especially where I am practicing. I'm practicing in Chhattisgarh. Most of the people don't even know how the baby is born. So they are just not aware of anything. So first of all, education is most important. Then only they will come to know about the sperm, role of sperm, the production of sperm, etc. Then when they are fully convinced that there's something wrong with them, then only we can go ahead with the treatment. So making them self-aware and educating them about how the baby is born, that is the most crucial step.
Definitely. So how do we go about educating them? Do you hold camps? Do you just talk with your patients when they come to you, or do you also go out and speak about these problems?
We don't usually go out and try to preach people. We only try to convince the people who come to us.
Okay.
I mean, we don't do any social media campaigns, etc. regarding this.
Okay, that's wonderful though. Whatever you're doing, that's great work. Dr. Pradeep, thank you so much for your time. I just want to ask you one last question before I leave you. What is that one particular advice that you want to give to people seeking help?
Actually, this is what I want to say is being practiced in Christians for very long period. They get their medical test done.
Okay.
One of my employee was Christian, and he told me, this according to him, that before they get married, they have to produce their medical certificates. They have to get their tests done. Then only the marriage can happen in their society. Okay. But I don't know how much prevalent this is. One of my employee was Christian, and he told me all these things. Okay. But this is the that I want to give. If you are planning to get married, then better get tested. Just before undergoing an operation, test you are undergoing, do it even before going for marriages. Okay. Tests for what specifically? Yeah. Sperm count. Sperm count, and for the female? For females, there is no single factor which can lead to infertility. A whole long list of abnormalities that can cause infertility in females. So simple ultrasound will tell most of the things. The status of their ovaries. So at least that should be done. Okay. So your advice, and this is very important too, your advice is for a couple gets married, they should get tests done for the male, a sperm analysis, and for the female, whose case will be more invasive, will be an ultrasound. Ultrasound is amazing. I mean, the very simple test, 2-minute test. Okay, that's solid advice. That's very good advice. Dr. Pradeep, what has been your experience using the AndroWash machine? Actually, that is the machine. I mean, concept is old, but the presentation is very new. I mean, it has come into a very handy machine, and it can do your work very fast and effectively and efficiently. So even the smaller clinics can go ahead with the basic procedures of IVF. IUI is the most common thing which is done nowadays. So that simple little machine has enabled most of the clinicians to do in their clinics only.
Have you tried using it?
Yeah, we have done it.
What do you think, sir?
Good machine. I mean, that should be, that requires a little bit more of advertisements, campaigns, so that people will come to know about that machine and they will start using it. Because sometimes I think 20% cases they get pregnant, 20% couples they get pregnant simply by IUI. So that is the first thing that should be tried.
Right. Yes, that's important because while a lot of patients are jumping straight away to IVF, IUI is a more simple procedure and less taxing on the female body also, and more cost effective.
Yeah, most cost effective, in fact.
Yes. So I'm glad that your experience with the underwash machine has been positive.
Yeah.
Here's one last question, doctor. Would you recommend a home insemination kit to your patients?
Yeah, first, I mean, that is the first and foremost thing that we suggest our clients, I mean, our patients, try it naturally with some ad. If that fits, then come to us, then we will do IUI.
Okay.
It is kind of step later. First, try at home, then come to us, then go for IVF.
Yeah. So that's so logical, right? Instead of just jumping straight away to a big procedure. Well, then, thank you so much, Dr. Pradeep, for this time.
Thank you. Thank you.
Even though you're very busy, you've agreed to do this and on such a short notice. From Subhak Health Tech, we wish you the very best in all your practice and in your personal life also. May God guide you, and take you to new heights.
Thank you.
Have a very wonderful day.
Thank you very much.
All right then. Bye.
Bye.